physiotherapy, and I help women hikers get back on the trail. And I mentioned last week that we would be talking about hip pain this week, so I wanted to get into that. And I'm teasing you a little bit today with the question, is your hip pain related to your sex life? Well, is it? So the answer is maybe, could be, kind of, sort of, maybe. So I want to try to show you really quickly the connection between these two things. And we're going to play a little game called, this is like a different version from, six degrees of Kevin Bacon. How many degrees from the hip to your sex life? Okay, so bear with me. I'm going to try to share my screen with you here, and I hope I can do it. Whoa, it went crazy. Hang on. That's not what I wanted to do. I know I can do it. I know I can do it. Okay. All right, let's see if I can get you oriented here. This is looking at a pelvis from the back, okay? Here is sacrum and the tailbone, okay? Here's like the back side of the pelvis. This is the back of the hip bone. Your buttock would be like right through here, okay? If we go deeper than the buttock muscles, then we're looking at some deep hip muscles. These are deep hip external rotators here. And the one that I want you to notice is this long one that sort of starts on the back of the hip outside of the pelvis and then dips inside the pelvic bowl here. Okay? This is obturator internus. And I'm going to show you one other picture here. I know I can do it. I know I can do it. Okay. And here's a picture of the pelvis. This is the back of the pelvis, front of the pelvis. I really hope that my little pointer is showing up. I don't know if it is. Sides of the pelvis here. Okay. And all of this we can kind of see at the bottom of the screen. That's where the urethra or P would be. Middle kind of pink rectangle is the vagina, and behind that is the rectum. And then all of this pink stuff around that is kind of collectively called the pelvic floor. But what I want you to notice is on the edge of this kind of ring, okay, we've got this white kind of semicircle. That's fascia. And this little slip of pink on either side, like little ears on either side, that's that obturator internus inside the pelvic floor attaching to the fascia there. So if we're asking ourselves how many degrees between fascia or between your hip and your sex life, 1 degree. That's how connected they are. Okay, so hip muscles connected to fascia connected directly to the pelvic floor. So as a PT, I really started out in the hospital in acute care and then moved into orthopedics. I did a lot of advanced orthopedic training, which just means I was a PT really working on muscles and joints and trying to figure out how do these things relate to pain and people having problems with doing what they want to do. Back pain, hip pain, neck pain, ankle pain, knee pain, whatever. Treating the muscles, joints, fascia, nervous system to help solve those problems. So I had done a lot of advanced training with that, but I was noticing that especially with my female patients, female athletes who had hip problems, a lot of times we were getting it totally resolved, but every now and then there was someone who didn't feel like it could totally solve their problem. So I started feeling like I think there's a piece of my practice and therapy that's missing, which is pelvic health or kind of women's health, looking more specifically at the pelvic floor. So I started doing more advanced training with that, taking classes, starting to see patients specifically with respect to these kind of problems. And sure enough, yes, that was a piece of puzzle that was often missing from my more complex women patients. And I'll give you one example. Recently, I saw a woman, she enjoyed running, and she had a high hamstring kind of sprain or injury, or that's what it seemed like. It was sort of up, tucked right up kind of by her buttock and groin. And she had already been trying some things. She'd done some chiropractic. She'd been to see an orthopedic manual therapist. And so by the time she saw me, it was like, all right, we really got to dig deep and see what's going on here. So sure enough, yes, in fact, she did need her pelvic floor assessed. And that very muscle that I was talking about, obturator internus, along with some other things, some neural tension that was related to her coccyx and that kind of thing, that was a really big piece of resolving this hamstring strain and getting her back to running, especially getting her back to running the distances that she wanted to run, which was like 5 miles. So that's really exciting when you can start bringing together orthopedics and women's health to really completely resolve women athletes and the kinds of problems that they're having. So I want to share one other story from the reverse, kind of like the reverse side of things. So that was someone coming in with what seemed like an orthopedic problem. One of the pieces to the puzzle was kind of like a pelvic or women's health treatment. So the other side of this is I had a woman come in because she was having pain with vaginal intercourse. And with talking to her a little bit more, the pain tended to always be on one side. Finding out more about her subjective history, she had had a total hip replacement. So started investigating. She'd had physical therapy for her total hip replacement. She'd completed that. But when I started looking more closely at what was the alignment of her hip like, what was her gait or walking pattern like, it really wasn't totally efficient. And she had some imbalances in the hip. So we started treating the hip, got the hip back online, got it working better, and that was the thing that resolved her pain with vaginal intercourse. So that's just kind of like two sides of how, we take the human body and we break it down into all these parts. But your body is not doing that. It's not thinking, I have a hip and I have a pelvic floor. And these are just because you go to see a therapist who treats one, you go to see a therapist who treats the other, your body is not viewing itself as all these separate parts. It's viewing itself as one thing that does a lot of different things. And so anytime you can find someone who can start putting all of your pieces together, then that can go a long way sometimes if you've got a complex problem. So okay, I hope that was kind of fun. And what I would love you to do is to comment below. If you have hip pain, you don't have to tell me about your sex life. I just want to know, where is the hip pain? Is it in the front of the hip, in the groin? Is it more on the outside, or is it more in the back of the hip? Because I'm going to do a few more videos about this, hip pain in general. And I'd love to know where you're tending to get hip pain so I can kind of tailor the videos to that. Okay, thanks for watching. Bye-bye.